Good morning, ladies and gentlemen, and welcome to the ICT&health World Conference. It is such a pleasure to start this day together with you. I'm Sunny Gronefeld, and I'm so excited to moderate this main stage over the next 3 days and learn together with you, learn from our keynote speakers, and hopefully, in so many ways, connect with the many brilliant individuals who are seated in this room and the many more who are to come. So, we're gathered here at a pivotal moment in healthcare. Digital health platforms, large-scale medical data analytics, and clinical AI are no longer future promises. They're technologies that are changing lives right now. And I think what makes this conference so unique is that unlike many other gatherings where there's just a segment of the healthcare sector in the room, this conference brings everyone together. In fact, roughly 70% of you are working in one space or the other of the healthcare sector. And having everyone at the table, in the audience, in the breakout sessions, enables all of us to have discussions across the system that we might not have in our day-to-day lives. So I really encourage you to take advantage of that. And then on stage, we will be meeting visionary healthcare leaders, policymakers, executives, innovators, technology experts, and so many more who are actively shaping this transformation as well. Now, I want to say one word in terms of mindset and how to best approach these next 72 hours. Many of you are, as I said, in the healthcare sector, and that means when you try out something new, you might be a little hesitant because for 363 other days of the year, when you're not here, being very clear about what you're doing and being very clear about not making any mistakes is important because human lives depend on it. But today, tomorrow, and the day after tomorrow, we are in a different space. Here, and everywhere around this room, it's a space where I encourage you to be incredibly curious, to be experimental, to try out new things. We have countless booths outside with innovations, and I want you to engage with them and really be curious. How exactly could this change things? Could this change things for you? Could this change things for your context? Try it out and be playful with it. Nothing can happen. You know, best case, you find something that is going to improve your way of working. Worst case, you learn something. And that's a delightful worst case to have. So, this conference has been designed for exploration and connection at scale. And one way we try to do that is obviously with technology. Who over here has already downloaded the app? A lot of hands, very good. If someone didn't put up their hand, now's a good moment to do it. The conference app will help you navigate the program. It will let you sign up for sessions. It will help you create a schedule, a personalized schedule. As you have seen, we have, over the course of these 3 days, roughly 10,000 participants coming through. We have about 150 breakout sessions in English, but also in Dutch for you across the spectrum, which I really encourage you, put your personalized schedule together, sign up via the app, and then you always know where's what happening throughout the day. And then you can also connect with each other, and we are also having a part of the app that permits us AI-based summaries of all the sessions. So lots of exciting stuff there, and I do encourage you to use it. And then, in terms of connections at scale, I would like to try something live right now to get you a little activated. You are seated to people you might know, but you also might be seated to people you don't know. And I encourage you now, over the next 60+ seconds, turn to someone you ideally don't know, if you are seated next to someone you don't know, and just briefly introduce yourself. We're going to give 30 seconds to each person, and then we're going to have a gong. And that means you need to turn your attention back to me because this could go a little wrong, but I know we're going to make it happen. So let's have Connections at Scale live right now. Go! That's great. All right, ladies and gentlemen. This is a lot of volume, a lot of conversation. I have to say, this is quite amazing, ladies and gentlemen, and this is exactly what we want. This type of exchange, it is rare. I've done this at a few conferences. It is rare that you get to that noise level that quickly. There's nobody who's shy in here, and that's fantastic, because this is exactly why we're here. It is to connect with those we haven't met yet. It is to exchange ideas. It is to challenge perspectives. It is to ask questions you might have not asked before because you're talking to someone who's in a different part of the healthcare sector, and you're learning from each other, and you're making each other better through that. So that is exactly what I hope will happen more and more over the next 72 hours, and I think we are in a great position to make it happen from judging from this first interaction. So with that, I have still 3 things that I want to mention. Just 3 things before we get started. Number 1, all the keynotes here on stage, also the panels, they will be recorded to the YouTube channel of ICT and Health. So that's going to be available for you. Then secondly, as you see up there, there's that little hashtag IWC26. If you're posting about this on social media, LinkedIn, Facebook, Blue Sky, X, whatever it is that you use, feel free to use that, and it will stay up there for a while. And then finally, as with many of these programs, there's always short-term changes. 72 hours of a conference, well, really a few hours less because we do want to sleep and enjoy ourselves in the evenings, but still, so many speakers on stage, so many breakout sessions, and so there are some short notice changes. I just want to make you aware of 2. One is that Razu Shastu will not be joining us this year as a keynote speaker, unfortunately, and Professor Ernst Kuipers as well, not this year, but next year. So just in case, please be aware of that. And now, without further ado, it is my distinct pleasure to introduce you to one of our main partners who enables us to make today possible. The municipality of Maastricht, and particularly the province of Limburg, has been such a wonderful partner for us over the years. And so, ladies and gentlemen, please give a warm applause, a big applause, to His Excellency, Emile Roemer.
Good morning, everybody. I'm glad everyone knows each other now, and that within 60 seconds. Very well, very good. Welcome in Limburg. My name is Emile Roemer. I'm the governor of the province of Limburg. Welcome in this beautiful province. Welcome in this beautiful city of Maastricht. Welcome at the 3rd conference, ICT&health Conference here in Maastricht. And it's very good to be here. When I talk to the people in The Hague, sometimes they say, sometimes they say, oh, Maastricht is so far away from The Hague. You are a remote corner of our country. But Limburg is the gate to Europe. We live with our friends, our neighbors in Germany and in Belgium. We work together with them. So I said in The Hague, when I draw a circle in Maastricht from, let's say, 100 miles, here lives 18 million people. When I draw a circle in The Hague for 100 miles, they have 18 million fishes. So, who's the remote control, corner of the Netherlands? It isn't this area. And what we have to do here, perhaps because of that, is working together with our allies, with our friends, within Maastricht, within Limburg, within Germany, within Belgium, within Europe. And especially for the healthcare, for health, for a healthy life, it's our duty to work together. It's your duty to work together. Only together we are able to find solutions for the challenges we are standing for. And there are lots of challenges. Everybody wants that everybody lives healthy. But what is living healthy? When you don't have the money to feed your children, or when you don't have the possibility for the education you needed. So let's help people for their own possibilities, but help each other to find the solutions of the challenges we have. And data, ICT, technological innovation, everything is incredibly possible when we work together. And here in Limburg we have the Brightlands campuses, where we work together with the government, with the province of Limburg, with the municipalities, but also with the universities, with the medical centers, high schools, companies working with technological innovation, and we all make moves forward. And that's what people want us to do. And that's why it's so important that we're here together at this conference from people from all over the world. I'm very happy and I'm very proud that you're all here and make it the best conference ever, so we make steps forwards. Thank you for being here. Enjoy working together. Enjoy listening to wonderful keynote speakers. Have a very good 3 days here in Maastricht. Thank you very much.
Thank you very much. Thank you so much for these opening words. The best conference ever. I think the bar is here, but we haven't come this far to only come this far. We are going to supersede all of it, and so excited for this 11th edition. Thank you so much for those opening words. Now I'd like to pass on to another main partner, speaking of Den Haag, the Dutch Ministry of Health, Welfare and Sport. It's an incredible pleasure to welcome the CIO of the Ministry of Health, Welfare and Sport to the stage. Please put your hands together for Bianca Rouwenhorst. Yes. Thank you.
Good morning, everyone. Whenever I come into contact with healthcare, one thing always strikes me: the incredible dedication of healthcare professionals. But something else stands out as well. how often health data still fail us. Information isn't available in time, or it's incomplete, or it isn't available at all. And all too often, this leads to frustration, especially to those very professionals who are doing their utmost best. And that's hard to accept, especially when you consider how far we've come in other sectors, banking, travel, shopping. With just a few clicks, everything works. Clear, accessible, and user-friendly. In healthcare, we're not there yet. And that's striking, because healthcare is about what matters most to all of us. Our health, and especially the health of the people we love. My name is Bianca Rouwenhorst, and I'm the Director of Health Information Policy and Chief Information Officer at the Dutch Ministry of Health, Welfare and Sport. So, that was a lot of words. It's my mission to help build a future-proof healthcare that serves everyone, today and for the generations to come. This is already the third time I have the privilege of speaking at this event, and a clear reflection of how important this mission is for me. As we all share this commitment, I warmly invite you to use the coming days to connect and to openly exchange and explore experiences and new ideas. Open your heart and mind, because only together can we truly advance the digital transformation of healthcare. The why of the transformation remains as urgent as ever, not just in the Netherlands, but across the world. We want healthcare to remain good, accessible, and affordable for everyone. Yet the pressure on our healthcare systems continues to grow. Demand for care is rising, while the workforce isn't growing at the same pace. Care needs are changing as people increasingly receive care within networks of multiple providers. And administrative burdens remain high, so the costs continue to rise. To meet these challenges, we have a clear compass in the Netherlands. Our national vision and strategy sets the course towards data availability in 2035. With 8 strategic objectives, it provides focus and guidance as we work towards a future-proof health information system. A system supported by all and designed to be easy to use and to match people's digital skills, because we want everyone to be able to participate. Guided that shared vision, our ministry, working closely with partners across the healthcare and ICT sectors, has already taken important steps in the digital transformation of healthcare in the Netherlands. For example, more and more health data is becoming available to citizens through personal health environments, services that allow people to view in one place to the health information held by different care providers. Many people can already access their GP records and vaccination data through these environments, with more information to follow in the near year and future. At the same time, significant progress has been made in developing a nationwide network of infrastructures, enabling the exchange of health data across existing systems and infrastructures in various institutions and areas, and ultimately ensuring data availability for primary and secondary purposes. But we should also be honest with ourselves. Not everything has moved as smoothly or as quickly as we've hoped. The scaling up of digital and hybrid care, for example, progresses at different speeds across sectors, depending on digital maturity and organizational readiness. In other words, the past year has shown us once again that digital transformation rarely follows a straight line. It's a journey with bends, detours, and, at times, strong headwinds. Yet, it is precisely these experiences that help us move forward. They sharpen our focus, teach us what works and what doesn't, and show us where we need to accelerate. This is exactly why 2026 must be the year of doing and scaling up. A year in which we move decisively from vision to practical experience, within organizations and sectors, but also across organizational, sectoral, regional, and national borders. Now is the moment to see how policy plays out on the work floor and where adjustments are needed to get organizations and their ICT ready so that data can actually flow, and to show how data helps professionals deliver better care, not by replacing them, but by supporting them in their work. One area where we can and must act concretely and pragmatically is artificial intelligence. AI has the potential to contribute across many parts of healthcare, improving accessibility, reducing administrative burden, and easing pressure on the healthcare workforce. That's why in the Netherlands, the Ministry of Health and several major healthcare stakeholders have agreed on a shared approach to the use of both generative and diagnostic AI. This has resulted in a national program focusing on two things. First, creating the right conditions for safe and effective use of AI. This means clear governance for validation and scaling, but also sustained investment in people. Responsible use of AI requires healthcare professionals who understand how these systems work, how to interpret outcomes, and when to trust them or question them. Strengthening AI readiness and AI literacy is therefore just as important as developing the technology. Included shared language technologies that can support professionals across healthcare settings. Second, moving from pilots, POCs, to implementation. The focus is on AI applications that make tangible difference in daily practice. For example, by reducing administrative burden through the use of speech recognition software or by supporting smarter capacity planning. The priority is not experimentation for its own sake, but broad adoption to solutions that have already proven their value. It's essential to have a clear framework for this work. We need clear boundaries to protect safety, privacy, and fundamental rights, and to give both developers and users clarity about what responsible AI should look like in practice. While implementation will be gradual, the direction is clear. Trustworthy AI by design. At the same time, Europe is also investing in its own AI capacity. In the Netherlands, this includes a newly launched AI factory that is part of a wider European network. For healthcare, this infrastructure provides the computing power needed to accelerate responsible AI applications, from reducing administrative workload to enabling more advanced diagnostics. Taken together, this means we don't see AI as a goal in itself, but as a powerful tool, one that can only deliver real value when combined with trust, skills, and shared responsibility. In that sense, AI brings us back to the bigger picture. It shows us that digital transformation is about much more than technology alone. It's about making choices, about leadership, about collaboration. And first and foremost, it's about people. Designed for people, shaped by people, and meant to improve people's life. That's why we should always keep the citizen's perspective in front and center and firmly anchored in our policies. We should never, but then also never lose sight of who we are doing this for. Let this be an invitation for the year ahead. Show courage experiment, move beyond endless deliberation, make choices, and truly work together across organizational, sectoral, regional, and national boundaries. Because the challenges we face are simply too large and too complex for anyone to tackle alone. Only by connecting, sharing, and acting together can we build that future-proof healthcare that people everywhere can rely on. To immediately reinforce that in the ID, I'd like to invite you all to use these days in Maastricht to exchange successes and lessons learned, and to connect national and internationally. If we agree that this is about people, then now is the moment to step up, to act, to contribute, and to help shape better health and better care for everyone, including ourselves and those close to us. So let's live up that responsibility here and now, together. Thank you. Thank you very much. And now, before we move on, I'd like to take another moment for something equally important, the handover of the chairmanship of the Global Digital Health Partnership. As I've just stressed, international collaboration and shared leadership are crucial for progress in digital health. A powerful example of this is the Global Digital Health Partnership, or the GDHP. Within this governmental network, more than 40 member countries and the World Health Organization work together to advance digital health worldwide. The Netherlands has been an active member since 2019 and had the honor of serving as chair in 2024 and 2025. And we look back with great pride on what was achieved during our mandate. 4 successful summits, many relevant workstream publications, and a growing and increasingly valuable partnership. Since the beginning of this year, Portugal is now the new chair of the GDHP, and we're confident the partnership will continue to thrive under their leadership. The formal handover took place at the GDHP summit in Canada last year, but I'm pleased to reflect on this transition here today. To that effect, I'd like to invite Katia Pinto, Head of Global Digital Health of the Portuguese Shared Services of the Ministry of Health, to join me on stage to do so. Hello, Katia, and we know each other very well because we did a lot of summits together. So, welcome, a very warm welcome to Maastricht, and also, of course, congratulations to Portugal on your new role as a GDHP chair. It was a great pleasure to work with you because you were for 2 years our vice chair, so we did have a very tense collaboration the last 2 years. I have one question for you. From your perspective, what makes the GDHP truly valuable, and how do you want to build on that in your chairmanship period? So.
Hello, Bianca. It's really a pleasure to be here, and thank you on behalf of the Ministry of Health in Portugal for inviting us. The GDHP, it's truly valuable. It's a truly global partnership where governments can engage in intergovernmental conversations away from the more formal negotiations and even away from commercial pressures. The Global Digital Health Partnership still stands as a unique partnership across the globe where we can share and understand practical implementation of digital health policy. Our goal within the partnership is to have this trusted space where we can discuss the right balance between innovation and regulation so that the citizen remains at the center of the healthcare reform that is going on most of the European countries. Portugal, as chair, we hope it continues to build on the good work that the Netherlands did in the past 2 years. And we want to continue to build this strong foundation for this global partnership for digital health. At a moment where digital health is core to our healthcare provision, all across the globe, Portugal will connect the different regions. Portugal will make sure that the partnership remains active with other international organizations and is a trusted place for our countries to rely on to discuss digital health policy and influence the course of digital health regulation across the globe.
Thank you so much, Katja, and thank you for being here for this handover. And again, congratulations again to Portugal, and I wish you wisdom. It's not a stair line, so wisdom and good luck and fun. And of course, the Netherlands will remain as a member, as committed a member to the GHP. And I'm excited to see where we are going to the next 2 years. Thank you very much.
Thank you.
Thank you very much.